they just let them go in. I think it's kind of changing. The younger, the newer pediatricians are following these guidelines, but you should do it in your practice as well. That if they're over 3 years old or 3, you need to be taking their pulses. Their blood pressure, okay? Because if you have a young patient, so a child, even an adolescent, who has elevated blood pressure, and before you go and start blaming their lifestyle habits, which I'll still talk to them about that too, but before you do that, you need to consider these things. And you need to listen and know whether or not, just keep your differential wide rather than just narrowing it down because you're like, oh, that kid, he probably plays too many video games and watches too much television, doesn't get out of exercise. Although hypertension is becoming more common for the younger population, it's still something that you need to just not chalk it up to that. Because that pigeonholing, where you just try and stick it in this pretty little box, is when you miss something big or important, okay? So do your best to try and keep your differential wide when you walk into a room. Don't just try and focus right in on what it is. Especially when you're a student, because it's okay. You can ask all the questions in the world. And if they get mad at you, you tell them that Dr. McNeil told Jessica that you're not allowed to get mad at me for asking questions. Also, something that's kind of one of those potential questions that they could tell you is like, it's more just a clue, it's a risk factor, right? Is that they could have a bicuspid valve. But that's also one of those that whenever you find somebody who has a coarctation of an aorta, you want to go ahead and get their echo so you can look to see if they also have a bicuspid valve, because that can cause them problems for aortic stenosis and those types of things later in life. Okay? A lot of this, when you talk about little kid stuff, is all about making sure they don't grow into adults with problems. So it's just about nipping it in the bud. Again, the pathognomonic type thing is that the blood pressure of the upper extremities is greater than that of the lower extremities. And another one is that they, on physical exams, will have a weak femoral pulse. This one, you're going to be looking for left-sided congestive heart failure, which is different than right-sided. Left-sided, you're going to have lungs, right? Cough, crackles, fatigue. And in school, I always hear people say rails and crackles, and I always was like, I don't know which one goes with which. So I'm telling you today, rails and crackles go together. I even Googled it to make sure that I wasn't wrong, because I would be like, is that a wheeze? What is that? Again, your ECG can show left ventricular hypertrophy. We're on the left side of the heart. Pathognomonic on a radiograph, so on an x-ray, is considered rib notching. Also, another word they might use is scalloping of the ribs. And basically what this is that because you have that, the top part is going to be feeding here, and it's going to be under a greater pressure, it's going to cause them to pulsate really big because they've got that extra pressure, and that's going to cause them to eat at the under part of the rib because they have a lot more friction, okay? And that's what's going to cause that scalloped look. There's also what's called three signs. I tried to find a picture of it that I liked, and none of them really looked all that great, so I just kind of looked over. You can Google three sign and see what it looks like. Basically, it's at the top, and it's just because of the kink, and it makes where the aortic arch, where the aortic knob comes out, it looks like a three. And I could very rarely see the three they were going for. Most of the time, I just saw the valve. So whatever. And again, our big thing is echo is diagnostic, and again, this is a TTE. There's your rib notching now. I think that one's pretty good. So you can see this boop, boop, boop. And please excuse my use of the word whatever. It's my replacement for today. I'm sure I've said as well. So gotta give me a break. I haven't given a lecture since I was in graduate school. Not that long ago. To make myself feel better. All right, here's your question. A 5-year-old girl is brought in by her mother for her annual well child check. While reviewing her chart, you notice her BP at this visit is 146/90. Concerned, you palpate for femoral pulses and find it weak and delayed compared to her brachial pulse. Her femoral BP is 100/75. Which of the following cardiographic findings is most likely associated with her condition? All right, well, I know you know what the answer is, 'cause I just went over it, but let's go over what the other things would be. What would a boot-shaped heart be? Y'all know that one? Okay. That one I'm gonna go over, so you should know it. It's the tautology of below. And it's not phallic, it's below. Rib notching is obviously what we're going for. What is a consolidation of a left lower lobe? Have y'all had palm yet? So what does the consolidation mean? Pneumonia. And then blunted diaphragmatic ankles. What disease would cause that though? We're gonna back that up. Hey, good. Look, you're smart. I don't even need to be here, right? You can just take it my lecture and be fine. Oh, the murmur for coarctation of aorta. This is not your thing, but I was looking at my flashcards last night, and I wrote this down. It's a systolic murmur, okay, and it's going to be on the left side, and what it is it's going to be where you can hear it in the axilla or in the back. So a systolic murmur that radiates to the back. That was the general thing. You can always Google, but there is a murmur. Yay! Tautology below. I like this picture because I feel like you could actually kind of see all the little pieces instead of it being like, this picture I feel like has too much business. But it has blood flow. This one doesn't have blood flow. So we have our four things. They're obviously a tetrad, right? There are four important things for you to know. You have, let's go to this one. You have pulmonary stenosis, okay? So that's here or here. You see these are so little. And then you're going to have right ventricular hypertrophy. So this side is supposed to be skinnier than this side, right? Because it's not supposed to work as hard. And then, so this one they have it thick and thick, okay? You have your overriding aorta, which means that you're going to have this here. It's going to allow the flow to go up. It means basically that the aorta did not fit along with the septum, from my understanding. I'm not a cardiologist. So by being overriding, it's basically being able to pick up fluid from beyond just the septum. And then you're going to have your ventricular septal defect that we talked about earlier, which is why the aorta gets all overriding. I just like this one better because I feel like you can see it here. This is the defect. This is the aorta getting all the extra blood. This is the teeny, tiny stenosis. Okay, and then the big fat ventricle, right ventricle. I'm talking loud enough, right? You in the back?
Yeah,
Okay. I just want to make sure. So the four components again: overriding aorta, pulmonary stenosis, ventricular septal defect, and right ventricular hypertrophy. I tried my best to not put initials all the time and to try and write them out, because when I had lectures in cardiology, they all wanted to speak in acronyms, and I was like, I don't even know what these acronyms mean. All I hear is alphabet soup. So please speak in words. And y'all can write on my little reviews if you think I did a pretty job of doing that. Anyway, so this is going to be that picture of that boot-shaped heart. Okay, it's another one of those. It's just the words they use. I'm pretty sure another. We won't use that word. I'll look it up and make sure that that's the right word. Sorry for my thought bubble there. This is going to be your most common cyanotic congenital heart defect. So your most common congenital heart defect is ventricular septal defect. Your most common cyanotic congenital heart defect is going to be tetralogy of below. Okay. And this one, considering we're talking about blue, right, cyanotic, we are going to have a right to left shunt. And when we're thinking about right to left shunts, makes a lot of sense why the right ventricle gets big, right? Because you're pushing stuff to the right side. So you're not going to have a skinny, tiny right ventricle anymore. Do y'all care that I've been sitting down this whole time?
No.
I'm just making sure, because I'm like, there's not a whole lot of space up there. I'd be all in your area. Anyway, so the way that these patients present is that they're going to come in, and it's going to be a mom. She's going to be talking to you, and she's going to be really scared. And she's going to tell you that sometimes her kid turns blue. And commonly it's when he's upset. He's going to be real upset, or he's feeding, all of these things, and he gets real dusty blue looking. And then sometimes if they're like toddlers and they can walk, they might say he gets real upset, he turns blue, and then he gets into the squatting position. And it seems to make him go, he turns pink again. I just think it's probably like a calming mechanism. I don't know, that's what they're gonna, like, they're trying to tell you they think something's wrong, but they don't know for sure, okay? They just see this thing, it turns blue, he squats, he's fine. I actually saw this once on rotation, and the mom thought that the kid was holding their breath, and that was why they were turning blue. And that they would go in the corner and squat, and that was him just like putting himself in timeout, and he was getting better. Like he just needed to calm down and not hold his breath. So I don't know, that was just the one case I saw, and it was off in Ada, Oklahoma, so who knows.
Easy.
Either way.
Easy.
Do it.
I said easy. That's where I went to undergrad.
It was a small town, and he wasn't on electronic anything yet, so. Nice man.
Nice. I'm just kidding. I have no relation to any of these.
It was a nice
I just play
town.
soccer.
I think every town in Oklahoma is nice, so it's fine.
No.
I was from a small town. I was originally from Duncan. So.
Woo! I'm close.
Oh, you're close. I was Marlow.
No, I'm from Hilton, but.
Okay. Anyway,
She's
so
further away.
I like got to like carry the all around. Anyway, again, you're gonna have these blue spells. They're often called pet spells. Crying can cause them, feeding, and they're typically relieved by them assuming a squatting position. Have you ever seen anybody with them, Shelley? I was shocked. I definitely was like, oh, really? They got referred away, and then by the end of my rotation, we got told what they were. So the murmur, a long, harsh systolic ejection murmur at the mid-left sternal border. It's not very pathognomonic. It just all sounds very vague to me. Just systolic, and it's at the border. The treatment is always going to be a repair in infancy, because the thing is that if you notice, a lot of these can be detected in fetal ultrasounds nowadays, and so you know the kid has the problem before they even come out and they can have it fixed. If you have a child who's turning blue, obviously that's a problem, and they're going to want to go to a cardiologist. That's when you're going to refer, right? If you think somebody has this, you're going to refer. This isn't something you're going to handle in your office. Because you've got to get that shunting of blood back to the lungs. Cyanotic usually means not good. We want you pink, not blue. A mother brings in her 18-month-old female infant for your evaluation because she's had multiple episodes of turning blue and upset. She states that her daughter often squats during an episode and turns to her normal color. What is the most likely diagnosis? Obviously, you're going to go with? Yeah, right. Tertology of flow. And I Googled how to say tertology before I got here, and I still think I'm saying it wrong, but... coarctation of the aorta, are they ever going to turn blue? Turner syndrome, do you know what that is?
Yeah.
Okay. Common things with that one's like the left neck, right? They have a lot of heart problems too, though. They have like hypoplastic left heart syndrome, things like that. I thought about talking about that today, but it was way complex and not on your topic list, so I was like, and obviously it is not normal given her age. She is not most likely holding her breath, so don't just write things off. Because little kids do like to hold their breath, but they're more likely to pass out than turn blue. Okay. It's the same setup here, okay? Nothing changed in the question except for the nothing changed in the stem, the question changed. What anatomical abnormality is most likely associated with her condition? Again, this is one of those things that, like, when you're thinking about a test question for this, they're not going to just put out all 4 of them and say which one. They might not. I'm not saying they won't. Say this baby has tetralogy of Fallot. They'll give you a clinical case. Okay, they're not just going to give you straightforward. Tell me which one of these is involved. They're going to want you to go through that stem, figure out what the problem is, and then be able, without saying what the diagnosis is, what is the common associated thing with it. So it's like a double layered question, and that's just kind of how these tests go. Is you will get there, and I remember so many times being like, I know what it is, I know what it is, get me to the bottom of this question. And then being like, and I don't know how to treat it. Don't know. So you need to know all the layers, okay? And so this one would be considered a layer question, because if we wouldn't have the last one, you would have to figure out what it was first, okay? And then let's go through them. Is aortic stenosis associated with it? No. Is pulmonic stenosis? Yes. Which ventricle is actually hypertrophy, left or right? Right, exactly. And is it an atrial septal defect or a ventricular septal defect? There you go. And again, people would be like, tricky, you gotta read every single word, right? Okay. Okay, 2:20. I didn't think I would talk this long, I'm sorry. Some final notes. Basically, this is from the American Family Physicians, can't remember the exact verbiage. I read an article for you that was over congenital heart diseases, and this is what they said was the time when you're going to refer. If you ever hear a murmur that's greater than level 3, you don't remember how to do the levels? Okay, yes. Anybody want me to go over them? I can probably pull that out of my memory. Okay. A diastolic murmur, that's never good. That goes for adults, children. Diastolic murmur is refer. And if it worsens with standing, okay, it's another one. And then, what kind of echo? Again, I already talked about this. A TEE looks at the back of your heart, talking a mitral valve. Commonly, the endocarditis will attack a mitral valve, so you might want to look there for vegetations. And I did see that on my cardiology rotation. And then the transthoracic, that's pretty much everything else. You want to look at the front of the heart. Interesting thing is that gestational diabetic moms are more likely to have children with congenital heart defects. This is why it's important to go ahead and get a birth history in clinical practice. And these are common things that they might put on there as risk factors to try and help you get in the zone on your questions. And then a reason why you would want to keep a PDA open is called transposition of great vessels. And it's like the main time you want to keep that puppy open. Because what's happened is your pulmonary trunk is attached to your left ventricle, and your aortic arch, or your aortic arch has attached to your right ventricle. So you get 2 independent circles. So all of your non-oxygenated, deoxygenated blood is flowing back through the body, and then all of your oxygenated blood is going right back to your lungs. So it's just a circle. And so you just keep this circle of having deoxygenated blood going out and oxygenated blood staying in the system of the lungs, okay? And so what this means is you're going to have a baby who's born blue, okay? So it's not something you're probably going to see. You might see somebody who had a repair of it. It's very uncommon. And what they call this, it's very diagnostic, is called an egg on a string. And so this is theoretically the egg, your heart, your pericardial sac there, and then going up would be the string. So it's just like it's hanging on a string, egg on a string. And that would be the one time you want to keep the PDA open, because that along with any other defect you may have, is the only way that oxygenated blood is making its way into the systemic system. So that would be one time you wanted to keep it open. So that'd be the one time you don't give into medicine. Those are all the things. if you do not know about medbullets.com, you should. You should go and check it out. That has not been passed around here. It's pretty much like, it's for the USMLE step 1, 2, and 3. But what they do is they go down and they do it in an outline format. They've got pictures, and they go over the most basic things, and a lot of times they have a question down at the bottom. So it's just very, I used it for board stuff when I didn't understand, and that, it really helped. So it's very basic, straightforward, no crazy talk about left to rights all that time, you know, just, I liked it, so. And then, of course, all of the resources that you probably have, or you might not. That's another one down here. I know you're not anywhere close to studying for boards, but even before boards, during clinical, this little book right here, Enhanced Prep Pearls, does anybody have that?
All of us.
It's great. And you should invest in that, in my personal opinion. I don't get money for that. Both of these, and this one's free, so you don't have to pay anything for that. But this right here, I think, he explains things, he makes associations. It felt like he was in my brain a lot of the time, because he picks one thing and he'll tell you how that connects to something else, so that that way you're developing greater connections in your brain, rather than just straightforward rote memorization. So, if you haven't, get with one of your classmates who does have it, let them let you look at it. It's not formatted in the most beautiful way. It's actually kind of sloppy in the format, but it's effective. So, just my 2 cents off my little soapbox. Okay.
Thank
Thank
you.
And you have a little early. Do you have a lecture after this?
Yes.
I hope I didn't hurt your ears for too long.
A must-see video.
Once I got off this left, right?
I decided not to buy.
He made 10 actors record personal. But 6 times. 6 times.
Okay, so since we've both been sucking at